Hey, it's Dr. Matt here today, and what we're going to talk about is how to maintain a healthy knee joint. You see, osteoarthritis is quickly becoming one of the leading causes of disability here in the United States. It's the 8th leading cause in men and the 4th leading cause in women, according to the World Health Organization. So it's becoming a huge epidemic that we have today. And so taking the proper care of our joints and being proactive versus reactive is going to play a critical role in your health, whether you're going to be able to do all the things that you love to do as you age and you get older, from golfing to running to exercise to going on vacation to being able to run around with all the grandkids and being able to get around your house up and down stairs without knee pain. So these are going to be some important things that I want you really to take note of and start working towards. So I've got 4 things here. The first one here is movement. Your joints love movement, they need movement, and they rely on your body's movement in order to stay healthy. You see, at a very young age, we lose the vascularity to our knee joints, to our hip joints, to our discs, to our shoulders, to many of the large joints that we have within our body. Now, does that mean that we don't get any nutrients in there? No, but there's a way that nutrients get in and there's a way that waste gets out, and that is through movement. You see, this hydrostatic pressure that begins to build up within the joints, movement will push that out of the joints. It helps to dissipate inflammation, it helps to bring in nutrients, and it helps to get rid of waste. It's absolutely critical to maintaining a healthy joint within your body. The second thing that we want to address when it comes to maintaining healthy joints is maintaining muscle strength or muscle balance properly. Now, this doesn't mean that you go out and you go lift a bunch of weights, or because you're in a gym that you're maintaining muscle balance. It's the interaction between muscles back and forth and whether they're carrying and moving that joint appropriately. So many times people with knee pain are going to have tight hamstrings. They're going to have weak glutes. They're going to have very weak quad muscles. And so we want to have this balance between the hamstrings and the quadriceps. We want to strengthen and stretch certain muscles in order to maintain that flexibility. In fact, there was a randomized study that over 5 weeks, they put people through certain quadricep exercises and exercised the muscles around their knee, and they found that there was a decrease in muscle pain, improvement in function, and reduction in arthritis long term. So this is something that we could be doing every single day to help prevent arthritis and keep our joints healthy. Now this plays to every joint in the body, but in particular we're going to talk about the knees today. Another thing that we want to do, and it's really what happens once the knees or the muscles become imbalanced, now the biomechanics or the alignment of those joints becomes incorrect. And the alignment of those joints are going to accelerate the wear and tear and degeneration. You know, most people that have knee pain, they don't have knee pain because they had a trauma or an accident or slip or fall that injured that joint. But it's a result of wear and tear over time. And it's the muscle imbalances and it's the poor biomechanics that create that wear and tear. You know, when we sit down with patients, they sometimes just don't understand why they have this joint pain, because they can't recall an injury or a trauma. And I said, well, it's not uncommon to have knee pain and not have a trauma. When you look at our society today and the fact that we're not as active as we should be, or certainly could be in our society today, it's no surprise that we're seeing a dramatic increase in arthritis happening within our bodies. Now, when we talk about nutrients coming into our knees and taking nutrients into our bodies, one thing you can do in particular is increase chondroitin and glucosamine. This is a supplement that you can begin to take. These are the components that help to make up the cartilage, as well as the joint components. It helps to decrease inflammation. Now, does it get rid of arthritis? No, it doesn't get rid of arthritis. It will help to provide the nutrients for some healing. It doesn't correct the biomechanics. It doesn't help to stabilize the muscles or balance the muscles, and it certainly isn't going to make up for you having movement. But putting these 4 things together is a great preventative action to begin to take those steps towards preventing disease within any joint, particularly the knee joint, which is what we're going to be talking about today. So if you like this video, if you got any valuable information out of it, please be sure to like it, share it with somebody. Now, if you also find that your knee has been more chronic lately, or the pain has gotten to an increase, give us a call, because we can certainly help people that this has progressed to a whole nother level, or if you need some guidance on getting it moving in the right direction.